Hey guys, my name's Jenna. I'm going to be talking about Staphylococcus aureus or S. aureus. It's a pretty common bacteria that I'm sure everyone has heard of. So what is it? It's a gram-positive bacteria. When you stain it to look at it under the microscope, it's going to stain purple, just as seen on that left image of a view of what it would look like under the microscope. And looking at it, it would be cock-sized shaped and then seen in kind of clusters. Many scientists refer to looking at S. aureus as almost a bundle of grapes. This bacteria is able to grow in aerobic and anaerobic conditions, and humans are the reservoir for it. So where can it be found? It can be found in the community, and it also can be found in hospital settings. S. aureus is already located on the skin and in nasal mucous membranes. It's kind of part of that micro biome of the skin. It's completely harmless until there's a breach in the skin, some sort of opening that allows this bacteria to get inside the tissue and inside the body to cause infection and that inflammatory response. So as we can see on the picture to the left, it can be passed in hospitals, mother to their child, can be passed through airborne transfers, and then also, as many children do, pick their nose and then kind of touch other surfaces. And so it can cause different types of infections. To the right, we can kind of see some examples of infection at a catheter site, or cardiovascular septicemia from open heart surgery, or some sort of infection from an orthopedic surgery where the body is open and the bacteria is able to pass through the exposed skin. It's pretty common in the community and also in hospitals. So how can we treat? Because it's a bacteria, we can treat through antibiotics. Unfortunately, from the overuse of antibiotics, as we have learned through class, there are many forms of resistant strains. One of the most common Staphylococcus aureus strain is called MRSA, and that is methicillin resistant. This type of Staphylococcus aureus contains the MEK gene that produces PBP2A. This specific gene allows the bacteria to continue to synthesize the cell wall, even in the presence of antibiotics, which, as we know, antibiotics are used to stop the synthesis of the cell wall to eventually kill that bacteria. So even though the antibiotics are present, this mutation of this gene is allowing the bacteria to continue to synthesize that cell wall, stopping the antibiotics from doing what it should be able to do. MRSA is resistant to not only methicillin, but also nafcillin, oxalicillin, and cephalosporins. So common diseases of S. aureus, if it were to enter the body, is bacteremia, infective endocarditis, skin and soft tissue infections, osteomyelitis, septic arthritis, meningitis, gastroenteritis, toxic shock syndrome, and UTIs. As you can see, S. aureus can kind of cause a ton of different infections and diseases in the body based on where it enters and the type of tissue it begins to attack in the body. So to prevent this, keeping a sterile and clean environment in hospitals is key to avoiding an infection into the open wounds or body cavities that are open maybe during surgery or IV lines, things like that. At home, you can wash your hands or use hand sanitizer, especially if you're in a elementary school and things like that, where you know kids are constantly touching surfaces after maybe putting their hands in their mouth or in their nose. And then also, if you were to get a cut, kind of cleaning the superficial cuts to avoid that bacteria from entering the body. And then the image on the left just kind of shows how that would happen. The S. aureus is already on the skin. It enters the body, travels through the nasal mucous membranes in that way, or the blood, and then will kind of produce a virulence factor, inducing autoimmune reactions in terms of inflammatory processes, and then it kind of affects different parts of the body. So in addition to the pictures, this is the reference that I had used to get all of my information. Thanks for listening, and I was excited to teach you more about S. aureus, since it's super common and already located on our body, and it affects a lot of our population and causes a lot of diseases in the hospitals.